Let's not fail Registry over a really simple concept. This is one of those questions that really trip up students, mainly because the vitals are so much different than we're used to. Let's jump into it and see if you guys can answer it. A 19-year-old male is found unconscious at the bottom of a stairwell after reportedly falling from a third-story balcony at a party. Must have been one hell of a party. Bystanders state he briefly woke up after the fall and was talking, but gradually became more confused before losing consciousness again. Assessment reveals a large hematoma on the right side of his head, a heart rate of 52, blood pressure of 196/64, and he has irregular respirations at a rate of 8 a minute. Now, before we jump to the questions, what do you think's going on? Why is the heart rate so low? And why is the blood pressure so high? Where a lot of students get mixed up here is they think that the heart rate and the blood pressure is a problem, and it's not. It's a response to the problem. Matter of fact, any attempt to fix those would make the patient get a lot worse. So let's look at the questions. So what do you think it is? Drop the two answers in the comment and the rationale why. And if you see somebody that you think got it wrong, let them know why you think you got it wrong. Let's just keep it civil. Now let's go see what clues we have. Well, unconscious is a big one. That paints a picture. And falling from a third-story balcony, well, that can create just about any injury you can think of. But he briefly woke up, was talking, and was acting normal. Now we got the large hematoma on the side of his head, which indicates he obviously hit his head. And then we got these odd vitals. So the clues in here is this really wide pulse pressure, hypertension, a low heart rate, which you wouldn't expect with that high blood pressure, and then we got the mechanism of injury. Now that we got the clues, let's move on to step 2 and identify what's going on. That increase in blood pressure, wide pulse pressure, a bradycardia, coupled with the mechanism of injury, point pretty strongly towards Cushing's reflex. But rather than memorizing a set of vitals, let's break into the pathophysiology a little bit. When we have bleeding into the brain, it can be epidural or subdural, and it can be traumatic or it can be a hemorrhagic stroke. Regardless of the cause, our skulls are, for the most part, sealed shut. There's one hole in the bottom called the foramen magnum, and when blood starts pulling into that skull, well, the pressure in the skull goes up. But for the brain to receive blood, well, the pressure can't be higher in the skull than it is in the circulatory system because blood's always going to move from a higher pressure to a lower pressure. So what does the body do in response? Well, it increases the blood pressure to greater than the pressure in the skull. This allows blood to make its way into the skull. Now, the heart doesn't like pumping against this pressure, so it tries to decrease it by decreasing the heart rate. But the brain's not going to allow that and continues to constrict those blood vessels to make sure that the blood pressure is higher than the pressure in the skull. Why is this an important concept? Well, as you work your way up through your career, a lot of paramedics have killed patients because they get hung up on that heart rate and they try increasing that heart rate. Or sometimes EMTs will administer medications like nitro to try to decrease the blood pressure. But if you're successful in decreasing the blood pressure, well, now the pressure is greater in the skull, which means you've basically just put a tourniquet around this patient's neck. So you see, the vitals aren't the problem, but they are a clue. They do tell you what's going on. Now, depending on what caused the bleed and where the bleed is, determines how fast this happens. Now, what about those irregular respirations? Well, as the brain starts to get squeezed, it starts getting forced out through that hole in the bottom of the skull, the foramen magnum, and that presses on the respiratory center and makes the respiratory system do some crazy things. And this is where the irregular respirations come from. Now, what about the traps? Well, most traps on every one of these videos I do rely on you, the test taker, to say, what if? And a lot of people say something like, well, what if it was an overdose? He was at a party, but nothing in the question steers you that way. An overdose wouldn't cause this set of vitals, and there's no other indicator that this patient overdosed. And then there's concerns about a spinal injury, which is easy to associate with a fall from 3 stories. But the problem is he got up and started moving around again. Common wrong answers I've seen on this test are people withholding treatment to administer Narcan just in case it's an overdose. And the Narcan itself might not hurt the patient, but any delay in their treatment and transport is. And there's not much we can do to treat this particular patient. So transport, aside from airway, breathing, circulation, becomes the highest priority. So anything that keeps us on scene beyond airway, breathing, and circulation is going to be a wrong answer. And then we have neurogenic shock. A lot of people think, well, spinal injury, neurogenic shock, fall. The problem is the one thing all shocks have in common is hypoperfusion. When we can look at this patient's blood pressure, he's got 99 problems, but perfusion ain't one. Just like most of the questions we do, all these traps rely on somebody saying, what if? If it's in the question, it's relevant. If it's not, it's not. Don't add to the question. Don't create a backstory, because you'll find yourself trying to justify one answer rather than looking for the right answer. So we decided it's intracranial bleeding. We made this decision because it was a low heart rate, elevated BP, wide pulse pressure, the irregular respirations, and we know we can't really do much for intracranial bleeding at any level from EMT to paramedic, other than make sure that we recognize it so that they get to the right facility. Because this patient needs a neurosurgeon. So ask yourself, are you taking the patient somewhere where they can get neurosurgery? And now this question won't be the one to get you on Registry. If you want a daily breakdown of these questions, check out sipandscan.net. I'll put a link in the bio, but until next time, be safe.